The World Health Organization says a cluster of hantavirus cases is under investigation aboard a cruise ship stranded off Cape Verde in the Atlantic Ocean. 7 cases have been identified so far on the MV Hondius. At least 3 deaths have been confirmed. The luxury cruise ship has been barred from docking at Cape Verde as a precaution, leaving 149 people, including citizens from Spain, Britain and the US, isolated on board.
I am currently on board the MV Hondius, and what's happening right now is very real for all of us here. We're not just a story. We're not just headlines. We're people. People with families, with lives, with people waiting for us at home. There's a lot of uncertainty, and that's the hardest part. All we want right now is to feel safe, to have clarity, and to get home.
The MV Hondius was on a weeks-long polar cruise, traveling from Argentina through Antarctica before reaching Cape Verdean waters on Sunday. Hantavirus is typically spread through contact with rodents. Earlier, I spoke to Amesh Adalja, senior scholar at Johns Hopkins Center for Health Security. He tells us more about the virus and whether the outbreak on a cruise ship is cause for wider concern.
Hantavirus is usually a rodent to human interaction. It's not usually something that transmits between humans. And in the situations where it has transmitted between humans, it doesn't do so very efficiently. So this is something that needs to be controlled, needs to be understood, but doesn't pose a major risk to the world.
Right. How deadly, though, is hantavirus to date, and how widespread is it currently in the world?
Hantavirus is certain types of hantavirus, particularly hantavirus pulmonary syndrome, where it affects the lungs, can have mortality rates up to 30% or so. And it's endemic in the Americas. In the United States, we probably have 20 cases a year or so. It's also something that occurs in South America as well. So it isn't something that's unknown. What's novel about this outbreak is that it's occurring on a cruise ship. This isn't usually where we see hantavirus outbreaks occur. It's usually someone who has exposure to rodent. So maybe they're cleaning out a shed or an attic or some part of their house where rodent droppings get aerosolized. So that's what's garnering headlines.
Now, would the remaining passengers on this ship then be screened for symptoms, and what would they be looking for?
They will be screened for symptoms. We still don't understand how they got infected. Did they get infected because there are rodents on board the ship that are spreading it? Did they get infected because someone brought it on board the ship when they were on an excursion in Argentina, which is in high season now for hantavirus? So they will be looking for flu-like symptoms, fevers, chills, muscle aches and pains, shortness of breath. All of those are the early warning symptoms of hantavirus.
Right, so we know the symptoms. Are there treatments, though, or vaccines for hantavirus?
No, there are no vaccines. There are no treatments. It's supportive care. So this is one where we need a vaccine, where we need antivirals, but we don't have any at this time.
Well, you were on the front lines during COVID-19. Does this situation remind you of the cruise ship outbreaks, which we saw then? And are we better prepared now to handle something like this?
I think it's really important to draw a distinction between COVID-19 and hantavirus. COVID-19 is an efficiently spreading respiratory virus. That is not what hantavirus is. So I don't think you can compare those fairly. The only thing that's in common is a cruise ship is involved. This is something that will be contained. This is something that's controllable. This is something that will not spread efficiently between humans the way COVID did.
Right. Well, the ship is currently banned from docking, though. Now, what are the key priorities now then for health officials in managing the situation on board?
The key priorities have to be evacuating the patients that are sick and need medical care, then understanding how this infection occurred. Are there rodents on board? How did these initial cases get infected? Is there any evidence of person-to-person spread? And then monitoring the individuals that are on the ship for 45 days or so That can be done not on a ship, but in other places to see if they develop symptoms. Again, this isn't something that spreads explosively from person to person, if it even spreads at all between person to person. So it's a very different rubric that they have to go through than with COVID-19. And I think we'll have answers in the next days or so.
Right. Well, what would need to happen before passengers, those who are not ill, can safely disembark, though?
Anytime there's an outbreak on a ship, you often find ports unwilling to allow the passengers to disembark. And that actually makes things worse. It creates distress amongst the passengers. If there is person-to-person spread going on, it makes it more likely to occur. It makes it harder for public health officials to investigate when people are all stuck on a ship.
Right.
So I think what has to happen is they have to understand how people are getting infected. Once they can rule that out, once they can understand what's happening, I think then the temperature will fall and people will be allowed to disembark.
Right, and I'm certain that this would potentially cause new sorts of regulations for cruise operators, or would that be similar to what we have today, which are pretty strict already, as I understand?
I don't think that this will change much in terms of regulation of cruise lines. I think this is an odd outbreak to occur. It is almost a one-off. I've never heard of a hantavirus outbreak involving a cruise ship. So I don't necessarily think it's going to change regulations, but it may increase awareness of hantavirus, especially among passengers who are disembarking in places where hantavirus is endemic, like Argentina.